Welcome to Dr. CM Edcast, your go-to resource for medical learning. Through discussions, case studies, tutorials, and debates, we help you learn, grow, heal.
So today, we're going to dive deep into one of the most profound things that can happen to the human body, a severe spinal cord lesion. We're going to look at what happens during that immediate, catastrophic shutdown, and the surprising automatic reboot that follows when the brain's commands just can't get through anymore. I mean, it's a pretty terrifying question, right? But the physiological answer is absolutely fascinating. It really pulls back the curtain on just how central the spinal cord is to, well, everything we do and feel, and what happens when that vital connection is just gone. Okay, let's get into it. All right, so before we can really get our heads around the breakdown, we need to appreciate the system when it's running perfectly. And the best way to do that is to think of the spinal cord not just as some simple cable, but as a complex, multi-lane superhighway buzzing with information. And here you can see exactly what we're talking about. It's the physical bridge between what your brain wants and what your body does. It runs all the way from the base of your skull down your back, this master communication line, all tucked away and protected by the spine. Now here's where it gets really cool. This superhighway is incredibly organized. It's not just one big road. It has very specific lanes, or what we call tracks. You've got your ascending tracks. Those are the northbound lanes, carrying all the sensory info like touch, temperature, and pain up to the brain. And then you have the descending tracks, the southbound lanes, carrying all the motor commands from the brain. And it's not a free-for-all on this highway either. Each lane has a very specific job. The spinothalamic tract is the one that's screaming, "Hey, that's hot," while the corticospinal tract is what's letting you do something as delicate as typing on a keyboard. It's this incredibly efficient, high-speed system that runs your entire life without you ever even thinking about it. But what happens when that superhighway gets completely blocked? I mean, a total shutdown. This is where we get to the heart of our topic today, a complete transection of the spinal cord. And let's be super clear here. A transection isn't like a bruise or a fender bender on the highway. We're talking about the road being physically cut in two. Communication doesn't just get a little fuzzy, it stops, dead. The northbound and southbound lanes are just gone at the site of the injury. So what could possibly cause something this catastrophic? Well, our source material points to a few grim scenarios. As you can see, we're talking about severe physical trauma, like a gunshot wound or a violent dislocation of the spine that just shatters the bone. But it could even be something internal, like a major blockage of the blood vessels that feed the cord. These are the kinds of events that can physically sever that connection, leading to the dramatic consequences we're about to explore. The very first thing that happens after a complete transection is a phenomenon called spinal shock, and it is exactly what it sounds like, the body's immediate and total shutdown. I want you to think of it like someone just walked over and yanked the main power cord from the wall. It's not that all the circuits below the cut are destroyed, but they've gone completely silent. The sudden loss of all those constant signals coming down from the brain throws the whole local system into a state of shock. And when I say the effects are total, I mean total. The paralysis is flaccid, which means the muscles are completely limp with no tone at all. All reflexes, even that knee-jerk reaction at the doctor's office, they just vanish. All sensation, gone. Even the automatic systems that control your blood pressure and body temperature, they go offline. It's a state of complete neurological silence below the lesion. But here's where things get really incredible. This silence, this shutdown, it doesn't last forever. After a few weeks, something remarkable starts to happen. The spinal cord below the injury starts to, well, it starts to wake up, but not in the way you might think. And you can see that transition so clearly here. We go from phase 1, that total silence and limp paralysis, to phase 2, where suddenly muscle tone starts to creep back in, reflexes slowly start to reappear, the system is coming back to life. But, and this is the absolute key point of this whole story, the connection to the brain is not being restored. This isn't a repair. What's actually happening is that the segment of the spinal cord that was cut off is learning to function all by itself. It's becoming its own local, independent command center. This is a perfect example of how it works. So let's say a painful stimulus, like a pinprick, happens on the skin of a paralyzed limb. That signal zips up the nerve to the isolated part of the cord. The cord gets the message, and without asking the brain for permission, because it can't, it makes an executive decision. It sends a command right back down to the leg muscles, pull away, now, and the leg moves. The brain has absolutely no idea any of this even happened. It's a pure local reflex. Okay, so all of this wild, independent reflex activity we've been talking about, that's the hallmark of a complete transection. But it is so critical that we distinguish between these two types of severe lesions because the outcome can be wildly different if the break isn't total. Let's go back to our superhighway analogy. In a complete lesion, the bridge is out. All lanes, northbound and southbound, are totally destroyed. No communication. But in an incomplete lesion, the bridge is a wreck, for sure. But maybe, just maybe, one or two lanes are still barely open. And you have no idea how huge that is. The survival of even a tiny number of those nerve fibers, a single open lane on that highway, means there's still a flicker of a connection to the brain. And that can make a world of difference, potentially allowing for some degree of sensation to remain, or even some voluntary motor control below the injury. So as we start to wrap this up, what's the big picture here? A complete spinal transection doesn't just break a system, it forces that system to rewire itself in a pretty radical way. You know, this quote from the source material just absolutely nails it. The spinal cord below the injury is no longer a messenger taking orders. It has become its own boss, running its own set of automatic, reflex-based programs. And we have to be clear. This isn't healing, not in the way we normally think about it. It's a profound adaptation. The body establishes this new, more primitive system to protect itself, all because its central commander, the brain, has been permanently cut off. And that really leaves us with a final, fascinating thought. When the brain is taken completely out of the equation, the body finds a way to carry on, using its own kind of local intelligence. It really makes you think about what control even means, and it reveals the incredible autonomous resilience that's built right into our own nervous systems.